Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
On our first show, we talked about the first cervical vertebrae and how the skull sits on top of it, and the next two below, the second and third cervical. Today, we want to identify there's the fourth cervical vertebrae making up the 7 of your neck area. Associated with the area of C4 and the tissue above it, that is the bone C3. And of course, below each vertebrae, there's another one. In this case, it's called C5. So the relationship of C3, C4, C5 in this case is the continuation of movement of your back or your spine, as you may call it. Associated with this area of neck muscles, however, we sometimes see an involvement of what we call the temporal mandibular joint. No, it's not a new band or something you smoke. It's TMJ for short, and it's right about here. It's simply where the jaw sits into the skull. The TMJ joint can be a very painful thing. If you've ever tried to experience eating an apple and you suddenly found your jaw frozen open and painful, that's a problem where the jaw is locked and its ability to range and movement is impaired. These jaw joints are involved also with neck muscles, which can also have an effect on our spine, including the cervical vertebrae we're talking about. So what can you do for a TMJ? Some of the simplest procedures are ignored far too frequently. Remember, the jaw simply sits here on the skull in a little dent, the jawbone comes up, and there has to be a little pad that separates this bone from touching that bone. A simple procedure that your chiropractic doctor can assess is whether or not the range of motion and the little synovial pad sitting in there are in their proper relationship. These areas have a very simple approach for treatment, and if it's going to be effective, you'll know in a very short period of time. These are some of the simple procedures affecting our jaw joint that should always be explored before more rather aggressive procedures take place. Remember, in our discussion today about C4 and its relation to the vertebrae above C3, below C5, age doesn't matter. It's always about range of motion and flexibility. So exercise, regardless of age, regardless of gender, it's about trying to ensure that the neck, as well as the rest of the spine, always receives some movement. So your stretching movements, your turning movements, these are all critical to one bone after the other in the spine. Your back is important to your daily health. Join us on the next show as we continue our journey down your spine.